sleeves and no need to have a table in front of you. How to use. How to insert the batteries. Take out the unit from the storage compartment. Open the battery compartment by sliding in the direction of the arrow. Insert two AAA alkaline in correct direction, matching the polarities positive, negative. Replace batteries when the low batteries symbol appears. Note: it is important to tell you that batteries supplied along with the unit are alkaline batteries, not the ordinary pencil cell. Step 2. Correct positioning. Important. Relax and be comfortable sitting on a chair for 5 minutes before taking a measurement. Wait for 30 minutes if you have just smoked or taken some other tobacco product. Either arm can be used to take blood pressure, but it is always better to use the same arm every time. Wrap the cuff snugly around the wrist. The cuff should neither be too tight nor too loose. Keep the margin of 1 centimeter between the ball of thumb and the cuff. Note: always wrap the cuff directly on your skin. Any clothes under the cuff, even a cotton shirt, will affect the accuracy of the monitor. Keep your wrist at the level of your heart by taking the support of the other hand, or if you have a table in front of you, then you can use the storage compartment to keep the arm resting on it. Most important, do not move your wrist, arm, or even fingers during the measurement. Remain still and quiet. Do not speak, laugh, or move the unit while doing the measurement. It is not advisable to take the measurement while standing. Step 3. Taking the measurement. Press the power button. First, there will be a self-check of LCD for 2 seconds. Then, it will display the last measurement for 1 second and it will start inflating after that. You will feel the obvious pressure on your wrist. After reaching the appropriate level, the unit will start deflating. The heart symbol during measurement indicates that your BP is being checked. This is your measurement. Step 4. How to analyze measurement. 122 is the systolic blood pressure, 77 is the diastolic blood pressure, 79 is your pulse rate. This is the date and time of measurement. Once you have taken the measurement, do not take repeated measurement immediately, as your arm is under stress. Let the arm relax for 5 minutes and thereafter you can take repeated measurement. This leads to temporary increase in BP and such measurements are not considerable. If you've moved your arm, wrist or even fingers during the measurement, this may lead the sensor to consider the muscle movement as your pulse. If you are wearing some clothes under your cuff, if you have spoken or laughed during measurement, if you did not keep the wrist at the level of your heart, if the wrist is kept too high or too low, as BP is considered at the level of your heart, if you have taken the second reading immediately after the first reading, your arm is under stress for next 5 minutes of measurement. Keep in mind that your blood pressure keeps changing naturally from time to time throughout the day. Your BP is affected by physical activities and your mental condition. So, you should not be too happy or too worried because of one particular reading. The interpretation of BP requires a regular monitoring. Keep a record of your measurements and tell your health practitioner about the trends of your BP. The reading should be interpreted by the doctor only who is familiar